acidity is not dangerous. Vomiting early pregnancy is not dangerous. Little here, little there. Okay, but what is really dangerous? What do we call as high-risk pregnancies, Poorni?
According to me, every pregnancy is precious, ma'am. But when we come to high risk, I would like to categorize into a patient, a woman who comes into a pregnancy itself already labeled as high risk. This could be because of some kind of a family history. She might have had a previous child who had some abnormality, previous abortions, or she might have had a lot of difficulty in conceiving, and she might have conceived having taken into some kind of treatment. It could be an IVF pregnancy. The other kind of high risk would be where it was a totally planned pregnancy and, things have been going well, maybe even up to the second trimester. And then when we are checking her at regular intervals, she may develop some of the complications which are becoming a little more common nowadays. It could be anemia, where the hemoglobin is low. It could be high blood pressure, or it could be the more common what we are dealing with nowadays is diabetes in pregnancy.
Yeah, so here is a question from Daksha. Having said so much, you eat, we are all telling a variety of food stuff, but Daksha has been reported with a high blood sugar, and you are still now further on trying to tell her more instructions about the diet. What could they be and why?
Once we detect for Daksha, if we've diagnosed that she is diabetic, I want to assure her that it's a good thing that we've picked it up, because a lot of women with diabetes in pregnancy go undiagnosed. So once we've picked it up, I want to tell her that most women with diabetes in pregnancy, we can take them through with just diet and exercise. And there really may not be a necessity to add in medication and insulin. That comes in a very, very small percentage of women. Now, having said that, the common concerns that a lady with diabetes in pregnancy has is, will her child develop diabetes later on? This is not something that she's going to pass on to her child, as in genetically. And the other thing is her sugars will come back to normal after she delivers, because this whole thing happens because of the hormones of pregnancy. And once she delivers, the hormones are going to come down.
So in high sugar in pregnancy, when you detect it, first thing is that you picked it up. You can do something about it. You can ensure that both the mother and the baby are okay at the end of this whole exercise. But they got to be disciplined. They have to keep the targets of the sugars. They have to follow the diet advice much more strictly than anyone else would do. So thank you for that.